Doctors are going on strike again, but the reason is not what you might think. It's not about money this time, but an absurd situation that they are in.
But why? Why?
No secret that we need more doctors. Waiting lists are going up and patients are understandably frustrated. But what if I told you that we have thousands of doctors who want to work, but there aren't enough jobs to go around?
Wait, what?
So if you've spent £100,000 on med school, starting to then work as a doctor for 2 years, and then decide you want to specialise to maybe become a psychiatrist or a gynecologist, well, there are only 489 jobs for doctors entering psychiatry training. But there were over 10,000 applicants last year. I'm sure you're also thinking that we need more GPs, right? Well, there were just over 4,000 GP training jobs last year, but 21,000 people applied. Competition for doctors' jobs have ballooned in the past few years. And it feels absurd because if you ask absolutely anyone, they'll tell you that we need more doctors to clear the backlog of people on waiting lists and treat patients in general practice and emergency departments. And the solution is simple. The NHS needs more funding so that hospitals can spend that money to employ doctors. And for anyone thinking that we can't afford to keep pumping money into the NHS, I don't think that argument makes sense. We know that more people than ever are needing to take time off work due to ill health, and this has a massive negative effect on the economy. But a healthy nation is a more productive nation, and if we focus therefore on health first, as was the whole point of the NHS when it was created, people's physical and mental health would allow them to return to work, which would then boost the economy and more than repay the cost of the extra doctors it needs to employ. P.S. If you're interested to know what the most competitive job was, watch my next video.